All right. Hi, we are group 4 and our EBP project is on the management of depression in adolescents.
My name is Ruth Abdu.
My name is Monica Busal.
My name is Jennifer Hahn.
Maria Ornelas.
And my name is Monica Torres.
So depression is a mental disorder defined by feelings of sadness and hopelessness and low self-esteem and the inability to find joy in previous activities and interests which were once pleasurable. Severe depression, when left untreated, can lead someone to contemplate and attempt suicide. The purpose of this project was to determine whether psychotherapy, so CBT, or IPT, which is cognitive behavioral therapy, or interpersonal therapy, along with pharmacotherapy of antidepressants, if that is more effective in the treatment of adolescents with depression versus the current standard of cognitive behavioral therapy alone. And comparing the two treatments, so the combination therapy of CBT or IPT with antidepressants, that actually showed to be more efficient in the management of adolescent depression by the decrease of depression symptoms, thus improving mental wellness and reducing the overall risk of suicide attempts in adolescents.
So the significance of the problem. There are approximately 9 million teenagers in the United States between the ages of 12 and 17 that struggle with depression. 37% of adolescents have symptoms of depression, and approximately 16% have even contemplated suicide. 11% of adolescent deaths are due to suicide, making it the third leading cause of death in teenagers. Several factors can increase the chances of children and adolescents to develop some form of mild to major depression. It could be a family history of depression, bullying, eating disorders, physical and mental abuse, and isolation. The rate of depression has increased exponentially in recent years as the use of technology and social media, in conjunction with academic stress, peer pressure, societal expectations, hormonal changes, and various home environments that have also increased.
So our PICO question is, in adolescents aged 12 to 17, does treating depression with cognitive behavioral therapy or interpersonal therapy with antidepressants, in comparison to the current standard of treating with CBT alone, reduce suicide attempts by 2030? So in review of literature, our search terms included pharmacotherapy, serotonin uptake inhibitors, antidepressants, cognitive behavioral therapy, interpersonal therapy, depression, suicide, adolescents, and teenagers. So our inclusion criteria were articles that compared CBT or IPT to CBT and IPT with antidepressants, and articles within 5 years of publication. Our exclusion criteria were articles that discuss depression in adults, CBT alone as treatment, and discussions of other mental illnesses other than depression, and articles that were published greater than 5 years. The total articles selected, we had 10 peer review articles that met the search criteria that were selected from the TW library, PubMed, CINAHL, Cochrane, and Medline databases.
Talking about the analysis of literature, some of our findings were Arango et al. In a randomized controlled double-blind trial found that the use of agomelatine 25 milligrams per day in combination with CBT for 12 weeks improved symptoms of moderate to major depressive disorder in adolescents in 49% versus the other antidepressant fluoxetine with 47% and agomelatine 10 milligrams per day with a 48%. The study compared these three antidepressants with a placebo, proving that the best result was with agomelatine 25 milligrams per day.
A randomized controlled trial conducted by Brown et al. In 2021 with total of 13 US sites of International Maternal Pediatric Adolescents AIDS clinical trial were included in the study with median of 13 participants per site, 8-week 24 youth with cognitive behavioral therapy and medication management tailored for significantly reduced depressive symptoms compared to standard care at HIV clinics.
In the article with Chung et al. In 2018, literature review from a combination of quantitative and qualitative studies was used to provide treatment recommendations. Primary care providers must participate in creation of policies and procedures to communicate with social workers and counselors to coordinate care. Consult with psychiatrists and therapists to refer patients with major depressive symptoms and evaluate the need of antidepressants. Combined therapy most effectively treats severe depression in this population. In the article with Foster and Mueller Co., this study analyzed a randomized controlled trial following 439 adolescents with major depression. The trial compared treating this population with CBT alone, antidepressants alone, a placebo, or combination therapy. This trial proved that combination therapy was most effective rather than either treatment alone, as evidenced by a reduction of 18.4% from the baseline depression scoring.
A randomized controlled trial was conducted by Foster and Mueller QO, and the outcome recommended that the treatment for adolescents 12 to 17 years of age diagnosed with major depressive disorder was that the combination of therapy with CBT and fluoxetine versus CBT only was viewed as the best outcome in the long run. Grover S. and Avasi A. Did a study as well, concluding that it is imperative to identify depressive symptoms in adolescents to treat and reduce the long-term effects of depression in this population. The outcome of this clinical practice guideline show that the combination of CBT and antidepressant is more effective than treating with antidepressants alone as well.
Lily, I think you're muted.
Right. So the clinical practice guidelines written by the American Psychological Association by McQuaid et al. In 2019 proposed the use of CBT or IPT concurrent with fluoxetine as a preferred treatment for adolescents with depression.
The clinical guidelines from National Institute of Health and Care Excellence provided evidence and new recommendations for combination therapy for children and young people with depression. The recommendations was the use of cognitive behavioral therapy in case diagnosed with mild depression, while combine the use of antidepressants and CBT for cases with moderate to severe depression.
In 2019, Self and McDonough did a literature review, including evidence that the combination of antidepressants, fluoxetine and escitalopram, and CBT in combination improved remission in 37% of the adolescents with depression, compared with CBT alone with a 16%. The review also provided recommendations for the screening of depression in adolescents during PCP wellness check visits and referrals to CBT in conjunction with an antidepressant prescription.
So a randomized control trial, which was done by Shakibai in 2018, the sample was 330 depressed adolescents ranging from 13 to 16 years old, And the study recommended that the use of CBT combined with pharmacotherapy or antidepressant, in this case was fluoxetine, that was the recommended treatment versus CBT alone or the antidepressants alone.
The outcomes of the literature review were supplementing first-line psychotherapies, which include cognitive-based therapy or interpersonal therapy with antidepressants, have proven to treat adolescents' depression most effectively. Agomelatine, fluoxetine, and escitalopram were three of the medications included in these studies. The study related to agomelatine was described as the first randomized controlled trial for this antidepressant, usually prescribed for adults to treat depressions in adolescents. Fluoxetine was mentioned as the only antidepressant approved by the FDA and the drug of choice to treat depression in adolescents. Literature review recommended the screening of depressions during wellness check visits with a primary care physician and the referral to CBT combined with the prescription for antidepressants based on the severity of the symptoms. After analysis of 10 articles, all evidence pointed heavily toward the importance of utilizing multiple forms of treatments to effectively treat depressions in adolescents.
So how we're going to disseminate this information? The incidence of depression in children and adolescents has been on the rise since the past years. Clinical recommendations include the screening for depression during primary care physician wellness check visits every year, using the Patient Health Questionnaire 9 modified for teenagers. If there is a score higher than 10, which indicates moderate depression, or if the symptoms of minor depression are persistent, they can be referred for a CBT evaluation and prescribed an antidepressant. It is very important that there should be a follow-up appointment after 2 weeks of combined therapy to evaluate the treatment. The use of combined therapy and yearly screening is important to achieve the goal of increasing to 46.4% the number of children and adolescents receiving treatment for depression by 2030 per the Office of Disease Prevention and Health Promotion. The access primary care physicians have to this population will help provide assessment, education, and treatment for depression. This is everything for our part. Thank you for watching.